It's not even working. Okay. Well, the clicker doesn't seem to be working. You're just gonna have to tap the mouse pad. But here it is, our first presentation by the Humphrey Fellows from VCU. We have Ayesha Tariq, who's going to present first on bridging cultures, supporting mental health in diverse classrooms. Then Tenzing, I'm sorry, I don't know your last name. From
Choden.
Choden from Bhutan, and you'll be presenting on international, multicultural mental health as well. I want to thank you both for coming and thank our audience for attending. I'm going to take a seat and turn it over to Ayesha.
Hi, everyone. Thank you so much for having me here. I'm very excited to be here to learn a lot about your experiences dealing with diverse populations and sharing my own experiences with you as well. So I'm Ayesha. I'm a clinical psychologist from Pakistan. I'm a PhD scholar as well, and I'm a Humphrey Fellow at VCU in the Substance Abuse Education and Treatment Program. 4 years ago, I started working in public schools across Pakistan. I'm from the capital city of Pakistan, which is Islamabad. And if you go to Islamabad, if any of you get the chance to visit there, you wouldn't find it any different from Richmond. The people, the classrooms, the schools, very similar environment. But because it's the capital city, that's why it's like that. And that's where I grew up, that's where I was born. And about 4 years ago, I started working in public schools across Pakistan doing teacher trainings. And I'm a master trainer. We go into public schools across the country and we basically train teachers into how to effectively work with children. It was during that time that I got a face-to-face with how diverse our own population in Pakistan is. We have 4 provinces there, and that was an eye-opener for me, to say the least, because very different from my experiences in my school and with my teachers. And these are basic skills that we're teaching teachers, and it was very surprising for me how teachers responded to those skills and how students responded to us going there as well. So I'll be talking about that a bit and sharing my experiences and getting to know you people as well. So,
Mouse pad. There you go.
okay, I would first, this is a question that I've been asked here since the 2 months I've been here, that what are the cultural differences I've observed in the US being here back home? And today I want to flip this question over to you guys. When you are working with diverse populations, what are the cultural differences that you've noticed, especially in the South Asian context or the Muslim community, for example?
Excuse me.
Right ahead.
I teach mathematics, and the biggest difference probably is that my students from Southeast Asia, from Bangladesh to Pakistan to Afghanistan, much better than many other students.
Mm-hmm.
I think it is because when they're young, they're actually thought different, thought to expect knowledge and try to acquire knowledge, and they are taught to study. So even though they are financially almost destitute and very poor, significantly better on average than people from some many other cultures. For example, ours. I think, in my opinion, this is the most glaring difference that can actually be pinpointed. Now, I came from the Soviet Union, actually, very long time.
Mm-hmm. So when you say they respect knowledge a bit more, how does that translate to maybe in the classroom behaviorally?
I teach online classes as well as face-to-face classes, so it's not a question of behavior. Question of behavior would be in public schools.
Mm-hmm.
We don't have a question of behavior. But they are much more studious, and talking to them, I can, I teach at Reynolds for 14 years. Before I taught in New York City, taught my first college class in 1990. And talking to students from those backgrounds, they are much more respectful to faculty. But that's not really very relevant. But they are much more studious. They study much harder, and they think systemically. They have, well, this is the amount of knowledge I should get in such and such time. Let me divide it into smaller pieces. Let me study each piece separately, and then sort of synthesize. So they have this systemic approach that was taught to them. But I think by studying many other things, I think it's an effect of traditional Muslim education in the process, analyze things, divide it up, and then do synthesis. I don't know if they're aware of it or not, but that's what I think it is. And that's, to answer your question, I think this is the most significant cultural difference because it does belong to certain cultures.
Mm-hmm. And I'll be talking about that as well. So.
Is somebody else? Go ahead.
I think what I see with my students, I've taught a number of students, not here at Reynolds, but in the university where I work, and they seem to be a little bit more reserved. We'll ask questions, but if they don't understand, like if something is said in the classroom that like is sort of American slang sort of thing, they're less likely to ask for clarification. I can usually see it in their face, and then I'll like ask them after class or something, was there something you didn't understand? And then I think there's also, honestly, I think they have a higher level of respect for professors than some of the American students, just because there's that comfort. I think there's a different type of expectation or that's just the way they're raised. Sometimes maybe a little bit reserved, maybe not asking them questions. But I agree, studious, committed, eager to learn, so it definitely reserved.
And it's that being reserved that I sometimes worry about. I know what depression and anxiety looks like in an American-born student, a student raised in the United States. But I worry that that reservation may be hiding some need for assistance that I could give if I knew it was there. That's a concern I've held for a while as I see the population of immigrant and refugee students coming.
Thank you. And that's something that I'll be talking a bit about as well, where that comes from. Anything else? Cultural differences. Because I know that you've asked this question off of us, but I want to know what you think as well.
I've had experiences in other countries where, especially when we're talking about mental health, people, it's like in South Africa, Black Africans are more likely to present with physical complaints, and it's not as cognitive as what we talk about in the United States or those things, but it presents more in physical illness, stomach aches, headaches, other somatic complaints that are much more common in that context. It's much more common in the Black population than in the white South African population, and that's one thing I learned when I was living there.
Absolutely. So there are a lot of cultural differences at play here, mostly because South Asian communities, Muslim communities in general as well, we come from very collectivist culture where more value is given to community, to honor, to moral values as well. And that does, at some level, mask a lot of the mental health issues, a lot of the mental health concerns as well. But it's not all negative. There are a lot of positives come from that as well. For example, the respect element that you talk about, that there's that thing with professors, with teachers, that we have to respect them in a certain way. And I'll talk about that more. So why is it important that we talk about cultural sensitivity? It helps build trust and rapport with your students a lot. Like we said, culturally masked mental health concerns. So, like David said as well, that because they're reserved, they might not be open to sharing as much about their emotional needs because in these cultures, endurance and resilience are values that are kind of looked up to. It creates a very inclusive learning environment. When you create an inclusive learning environment, it makes students open up more, it improves academic performance, enhances communication and interaction competencies with you and with your students as well in general. And what happens when these things are overlooked, when we're not being culturally sensitive? A lot of the behavior and affect can be misinterpreted as well. So you said the thing about being reserved. You find the students a lot more reserved. One of the reasons for that is, especially if I'm talking about where my university back in Pakistan, we're not really encouraged to question professors and teachers in class. So if there's a class going on and if we interrupt the professor and say, oh, I don't understand anything, or if you question anything that they're doing, that's not really encouraged, that's frowned upon. So the thing about being reserved, it's not that the student isn't interested in the lecture, it's not that they're not engaged in the lecture, it's just that the background that they come from, it doesn't really encourage questioning, especially people in authority as well. So that can be a misinterpretation that might happen. And in terms of affect as well, students might look like they're bored, like they're not engaged, when in actuality they are learning, they are engaged in the classroom. But due to this misinterpretation, it's just general human behavior that if there are students in class, some of them are being more interactive than others, our focus just naturally goes to them a bit more, slightly more. But that's a very human instinct as well, to call upon the students who are participating to interact with them more. And because of the interpretation of behavior, misinterpretation of the reserved behavior, it can also lead to a bit of isolation and alienation of the students who are in class, and that kind of increases the misunderstanding and it increases that gap as well between the teacher and the student, which also decreases support-seeking behavior. So if the teacher isn't interacting with them more or giving them that opportunity, then they might feel like they cannot ask for help in return as well, because that is something that they do learn from back home. And all of that just leads to eventual disengagement from classrooms in a social sense, in an academic sense as well, where we see decline in academic performance, socialization, and overall behavior. What are a few of the challenges that you have faced when dealing with diverse classrooms, other than students being reserved?
There's some self-segregation that I notice. If students are coming from similar cultures or regions, they'll coalesce even if they're from different countries or different religious backgrounds, but there's enough common ground that they tend to self-segregate and maybe separate themselves a bit from the other culture.
How does that become challenging?
It's not always a challenge, actually. If I'm careful about it, I can use it to create a support system where they can support each other in the classroom.
What I found that is very interesting in that situation, I teach biology, so they have to work together in these lab groups. I've found that there are certain times when they will choose to work separately. And there's that balance of, do I respect that you want to work by yourself? Or do I kind of say, okay, this is how the classroom goes. You don't have enough materials for you to work by yourself. You need to work in this group. And I'm always torn between that decision. I also find that I use a lot more slang than I think I do. And you're right, I see the looks on their faces, and they're just like, what? And I had a student tell me one time that she went to history class, she was from Brazil. And of course you know who George Washington was. Of course you know who, and she spent so much extra time out of class trying to figure out who these people were because it was just assumed that she knew. So I tried, after having that conversation with her, because I made some comment about Sesame Street. And it was, right, and it really opened my eyes to like, oh, I can't say, like I have to explain myself. So that's what I find. I try to make biological concepts something that is relatable to them, but I have to be careful of relatable to you and their background and their worlds that they brought into the classroom with them.
I was thinking about what Karen, Dr. Neal said.
Karen, not doctor yet.
Okay.
I got a year.
Professor Neal. About what you were saying about that respecting that you want to work alone versus joining in, and I raised for me another question, which is that concern about the boundary between your cultural background versus saying you're here at an American college and I need you to make an effort to integrate into this, at least this academic culture. I'm not talking about a broader assimilation, but integration into the sort of group culture of a college or university in America. And that being respectful versus calling that forth.
There's a hand raise up there.
We have a hand up here.
Hi, this is Karen Layu. I just wanted to say, one of the interesting challenges for me is that idea of being reserved and not wanting to speak up. So, for example, I think the challenge for me is to make opportunities and spaces for those conversations to happen. So, what I mean by that is I have this semester several students who are from South America, and I teach geology, and we've been talking about earthquakes and volcanoes in South America. And I always encourage students, like if they have experience with the earthquake, tell us about it. And I know these students did because they talked with me the class prior, but they didn't want to share in front of the rest of the class because I think they're sensitive to their English speaking skills. And so it's that idea that but they spoke to me at the end of class after other students were gone. And so I think part of my challenge is when I notice that I have students who might be struggling with the language barriers, because it's not just the English barriers, it's the science vocabulary barriers, to make space for them to talk with me.
That's a huge thing as well. The terminology, the references that you're using, and all of those things as well. Because in our cultures, yes, we use references all the time, but they're more according to our text, according to our history, according to our background, not necessarily according to the American background. So some of the reasons behind these challenges are, number one, cultural stigma. There's a whole lot of stigma back home about, in South Asian communities, about mental health. You're not necessarily encouraged to talk about your feelings, your emotions in that much. There's a lot of pressure regarding conformity. You have to present yourself in a certain way. You have to act in a certain way, because community living comes with its challenges of what will people say if you're not dressed a certain way? What will people say if you're doing this? And then there's the thing about identity struggles. They're dealing with this dual identity crisis, internal conflict as well, where they have to find a balance between their cultural identity, how they are back home with their family, with their friends in their country, but also how they are in the West. In the US, that identity is a lot different than their identity back home. And I was having this conversation a few weeks ago with a friend that language plays a very important role in that. The person that I am when I'm speaking Urdu is very different from the person that I am when I'm speaking English. And that makes such a huge difference because in Urdu we have words for explaining how I feel, certain phrases that I would use that I do not know the replacement for, the correct replacement for in English. And that creates a lot of the communication and language barrier as well. So like you were saying, talking about references in classrooms, right? We had something a few weeks ago where Harry Potter was a big reference. And a lot of the people hadn't read Harry Potter. They didn't know what Harry Potter was. And for like me growing up, that was very easy that, oh, it's that. And I would make that reference in conversation, but hadn't realized it before that people do not know what it's about. And then misinterpretations regarding culture, regarding religious practices as well. Especially, I would say, regarding modesty, if you're talking about Muslim students or from the South Asian community in general. Men and women, they're not really that interactive with each other. So, for example, if I were to go up to a man and present my hand for them to shake, they might not necessarily take that. And again, that's a huge thing as well. The same goes for eye contact. You're not supposed to make eye contact with your elders. You're not supposed to look at them directly in the face. You're supposed to kind of bow down, look down, or just not do that. And I can understand how that would seem very rude to people here, that they're not looking to me, they don't want to shake hands with me or laugh with me that much. Something happened with me at a family gathering a few years ago. I had a cousin come in from a village in Pakistan, and they came over to Islamabad for a wedding, and I went up to them and I said, oh, hi, and I started talking to them, and they just looked down and ran out of the hall. And later on, when we were back home, my parents were talking about the wedding, and they were like, oh, he's such a good kid, we had a good interaction with him. And I'm like, what are you talking about? He just looked down and ran away. And they were the ones to tell me, that's how it's supposed to be. You're not supposed to be that interactive. And I think that's something that people miss out here as well. That how you're supposed to interact in terms of gender differences. And language and communication barrier. There is. Okay. So, recognizing signs of distress. A lot of the signs of distress, they are universal, they are general. So, decreased socialization. They don't want to work in groups. They're not talking to the same people that they were talking to or they were friendly with. Might be a cause for concern. Decreasing academic performance. So yes, people from Asia, they are South Asian countries, very studious, very methodological in that sense. But if you see a consistent decline in performance, that can indicate a problem. Reduced activity levels, they're not taking part in hobbies and activities as they were before. And something that Wendy highlighted as well, South Asian communities, we see a lot of psychosomatic symptoms when it comes to mental health. So at the hospital, my largest source of referral, I work with children and adolescents, is from the gastroenterology department. Students coming in with stomach aches. You want to add something?
That's a thing in the United States too.
Mm-hmm.
Big, I got a stomach ache, I got a headache.
Yeah, or any non-localized pain in the legs, in the shoulders, feeling dizzy, things like that. Especially with students, we see these things in the morning, before class, before presentations as well. So a lot of psychosomatic complaints, and this is more prevalent in South Asian communities than they might be over here, because children are not taught to talk about emotions, about feelings. And when you don't know how to label a certain feeling, it gets stored somewhere in your body. And that in turn creates that system, that symptom, that sign of distress, so to say. It was a thing that, okay. Before we go on to support, one thing that, what you said about respect. They tend to respect teachers a lot more than maybe the US population does. In our culture and my religion, we're taught that teachers have the same level in your life, have the same position in your life that your parents do. So there shouldn't be any difference in terms of respect when it comes to your teachers as it is when it comes to your parents. Growing up, I know that I wouldn't necessarily be allowed to complain about a teacher because the teacher knows what's best. And it is generally the case as well, at least in my context it was, that teachers are given that respect. So yes, we're not supposed to interact with them in that level of comfort that we are with a friend. So for example, if someone can talk to their friend about smoking or drinking, you might necessarily not do that with your parents. You might necessarily not do that with your teachers. And then having that comfort in classroom as well, you wouldn't necessarily want to interact in that capacity of making jokes around the subject or any of those things. Because teachers are given that position, they are given that respect that you're just not supposed to cross. Providing support. Because it's a collectivist community, family involvement is very important. I know over here, once the student joins university, they're on their own. You can't contact their parents, you can't reach out to them. That's not how it is back home. Even in their in university final year of their undergrad, even in their masters, if a teacher would see a behavior that they think needs to change, they would call the students' parents. They would involve the family. Of course, after talking to them, I'm not saying that mental health, when it comes things about mental health, it's not that you go directly to the parents. Yes, talk to the child first. But family involvement is important in terms of social context, in terms of that support system as well. It's also something that I very much disagree with when we're translating or adapting a lot of the therapy modules that we have to back home, because therapy modules, they're very individualistic and they focus on the client rather than on the larger community as a whole. And without understanding that in our culture, parents, family members, elders, they are involved and they do have an impact in improving that health. So that is a huge thing. Culturally relevant communication is very important. That basically means, yes, I understand your point about having them involved in the US classrooms, in the US culture, but also maybe trying to learn about where they're coming from, their cultures, and why they're connecting with other students a bit more. One of the huge things with that is the language barrier, is language, because we're comfortable more in our language than we are in any other language. I'm very comfortable with my cohort. I'm able to talk to them and converse with them. But if I'm having a bad day, I don't necessarily want to talk in English. I just don't, because I can talk better in Urdu when I want to vent. I would rather use that, and for that I need someone to interact with, who understands that language, who understands that context as well. But increasing opportunities for culturally relevant communication, trying to learn their culture a bit more, their opportunities a bit more, can help increase their participation. And respecting students' religious practices as well. So things like communicating directly or all of those things in a more modest context, I would say, rather than being too forward, too direct, because that is something for a lot of the students that might be a barrier, that might be a boundary that they wouldn't necessarily want crossing. And that's okay as well. One thing that I know, especially regarding religious practices, is that, and this happened in the cohort last year as well, if I can share that, is my alumni buddy, he shared that with me, that when he started the Humphrey program, he was very surprised because there was programming scheduled for Friday. Back home, Fridays are half days. We do not work after 12 or 1 because we have Friday prayers, and that's a huge thing that everyone gathers for. And for the first 2 weeks, he didn't say anything, but third week, he was like, I should talk to someone about it. As soon as he did, Friday programming was changed in a way to accommodate that. So students might not necessarily know that they would be given the support if they asked for it. And that is a huge thing, that there's that barrier that, oh, if I say this, maybe they'll take it the wrong way. And maybe they won't change that. But giving them the opportunity and explaining, being more mindful yourself as well regarding these practices, not just like prayer times, but fasting as well. Things like that. So maybe not do a lunch when someone else is fasting or things like that, to create that inclusive environment in classrooms, and providing an opportunity for anonymous support as well. Because students are not necessarily encouraged to talk openly regarding their experiences, regarding their emotions. So providing that anonymous source where they can come confide to you, maybe through email, through messaging systems, anything that gives that anonymity, that they can communicate without being judged and without having a fear of what might go wrong.
Can you give us some, so I do, I take students into clinical settings, so we're there for 10 hours. So I had a student who was not eating or drinking. I knew what was going on, but they had never relayed to me that this was practice. And I've had students pass out in clinical meetings, so I'm always encouraging them, like, snack in the morning, you're on the floor, it's busy. And I was worried all day about the student, but I knew that that wasn't. So I was like, I wasn't sure, like, I just was like, so we're not eating, you're not eating lunch? And, I'm not eating lunch, so, but I guess they don't, I got the feeling like the student's very quiet, very reserved, like they don't want to say, oh, I have to do this, because maybe they feel like it might be like, you can't attend clinical, you can't eat during the day. Like, I think they're worried there's going to be some question because of their situation. And I just don't know, like, how to, it's additionally, it was like I was worried about the student because it is a long day and it's hot during the 10-hour shift. So I just was kind of curious, like, clinical situation, like, how do we say, like, have anything that's going on? I mean, I always tell them, like, if you have anything going on at home, we have lives outside of here, let me know what's going on, but in their students, they will not say anything.
So have you tried communicating with them one-on-one?
Yeah, I mean, I communicate with them one-on-one, and it would just be nice to know before the clinical day. And I was just thinking, like, as the nursing staff, how could we maybe talk about that in our orientation sessions prior to clinical to make sure that it's comfortable and they're going to be okay.
It is about having those open.
It's a physical concern. I'm just worried about the student.
It's about having those open and mindful discussions again, because I was studying in the UK, and if I'm not eating, I'm fasting. So the fast there was really long, so I wouldn't have to eat or drink the entire day. But it is being more mindful and asking them their practices as well, specifically hearing that is there a specific reason you're not doing this? And encouraging it throughout the semester as well, not just at orientation. Because at orientation, everyone is supposed to be proper, everyone is supposed to be in order, because they're starting at a place that's something new. So that initial hesitation, that reservation is there. That might not be the case a few weeks or a few months down the road. So being a bit mindful of that. And I would say in the religious context, especially if it's the fasting month or the fasting day, if there's a way around the clinical, having a shorter day, having a shorter.
It's very strict. Like, you have, by the Board of Nursing, you have to be in this number of clinicals, and our schedule is so tight. There's really not. I mean, it's it's difficult. I mean, we have a hard time trying to find time when it comes. So,
I don't mean to interrupt, we have
Yes,
another
yes, yes,
presenter,
yes.
and I want to get her some time.
Yes, because
Um,
she's gonna talk more about sport as well. So, yeah. But I would say that's just one last comment. It's about again asking them how you should help them, rather than giving them solution. So yes, I noticed that you haven't been eating. Is there something that I can do to help that situation? If you're feeling this way, how can we help?
I mean, so if you're feeling dizzy or feeling this, please come see me. Do not be in a patient's room if you're feeling that. It's the same issue as well. You're not eating.
I also think there's an association of Muslim nurses or something along those lines. They might be
Yeah.
able to advise on that.
Okay.
Thank you so much.
A very good morning to all of you, and I highly value your presence here today. I think it speaks volume and holds a lot of weightage about how you have this genuine motiveness and passion to actually help people that come from diverse cultural settings. And a little background about myself. My name is Tenzing Choden, and I have my master's in counseling psychology and my postgraduate diploma in cognitive analytic therapy. And I'm also an international certified addiction professional. And basically, back home, I work at a college known as Royal Thimphu College. And that is where I get to deal with a lot of international students because we have an MOU signed with a lot of US universities like UC Davis, Wheaton, and several other universities from Australia and Europe. So my counseling is not limited only to the local students, but it is also on an everyday basis that I get to see American students, European students, and students from different cultural background. And I feel blessed as well because side by side I work with an American counselor, and it's so interesting how she integrates the Buddhist philosophies along with her American cultures, and it's an interesting thing for me to learn, especially when I counsel American students, and to be more sensitive of the culture that they come from. And basically, Bhutan, like any other Asian community and a developing country, we have, this is just the overview. I think I'll skip this, I'm sorry, because of time. So basically, this is just an overview of mental health of Bhutan I'm going to talk about. Background of the college I work at, which I already mentioned. Tools to recognize mental health in a culturally diverse setting. Guidance and tools while dealing with diverse population. And a short video on one of the most vital reasons of mental health issues in Bhutan. And this is the overview. So basically in my country, like any other developing countries, mental health is something that is very stigmatized and it's a taboo. And just out of recent, people are actually coming forward to speak about it. I think that is also keeping in consideration that we have a lack of language, and that stems from the grassroots level, which is family. For me, I wouldn't be so okay to express to my family members how I actually feel. I feel we as Asian community, we are more cognitive. So I would rather, or the local students that I know who come in for counseling, they rather prefer someone asking, what do you think about it, rather than what do you feel about it. They have more to say. Just when you reframe the word, there's so much more to say and more value to add to the conversation. So because of that, I feel mental health is something that is still developing. And also the other thing is that I'm one of the 5 or 6 people in my entire country that has a master's in counseling psychology. And it's the gap is really large and big. And even the hospital, since it's so limited in number, the people who actually want to seek those services cannot because of the wait time. And I think that's why it's so essential. I was just before I joined this Humphrey program, I was also trying to train all the lecturers and the staffs at my university as to how can they, even though they may not be a certified mental health professional as such, but how can they act as a gatekeeper where they develop just the basic skills of listening, non-verbal cues, or some checking up, and just having a person-centered approach to deal with these students, because everyone cannot always be there to provide the mental health support, but as an individual, as a layperson, what can I do at my level to help the student for them to access those services? So that's what I've been working on currently back at my university. And this is where I work at. It's called Royal Thimbu College, and we have a lot of international students who come in every semester for an exchange program. And just swipe this through. And this is a very high number considering that we have just 1,500 students in our college, and we have 2 counselors. So these students are actually seen by me in the last 3 to 4 months. So we see like a Bhutanese students, total of 62, international 22, and we have international faculty more upfront about seeking these services as compared to a local Bhutanese faculty. I haven't had ever even one Bhutanese faculty who's come in for counseling because they feel it might impact their resume or their CV or their academic standing at an institution. And you may be surprised as to why the number is so high here. It's only because they are mandated sessions. Out of this, I think it's just like 5 students who actually come voluntarily. Apart from that, it's fully mandated. And either they have attendance issues, they've been caught using substance, or they have been caught bullying someone. So this is the only reason why the number is so high. And these are the common mental health cases which we see in the college. And again, I think I won't focus on others much today because of time, but one thing I think which really stands out to me while counseling American students and Bhutanese students is that the concept of sexual consent. I think when I've had the chance to deal with local students who actually experience cyberbullying and have their partners share intimate pictures of them and revolve around it on social media and threaten to share it if they leave the relationship, Bhutanese and the local students are very hesitant. They rather stay in the relationship than get exposed to the shame and embarrassment. And also because it's so taboo and this is not something we speak about freely in our society, they rather keep shut and just stay in the relationship. So that is why I was trying to also work on, recently it got executed finally, on a policy of sexual consent and cyberbullying and what can we do. And compared to an American student, they would be okay because that is also a discrimination of their rights. And they although they feel hesitant and shameful, but in comparison, they are more, the local students are more reserved. And I think that is a very difficult issue, especially when we have to go to the police station to report the case. It becomes a whole different matter. But I think the sexual consent, it's very interesting. And also I was reading up a study recently on the perceptions of Asian American students. And this study was conducted in California among 3 public universities. And what they found among the college students from the Asian American background were that they rather, even though they know the services are available, the support is available, they rather keep quiet about the situation because they don't want any other Asian friend in the community to speak about it. Because all the families are so interlinked, they are just afraid that it's a word of mouth in our Asian society. So because of that, they are afraid to seek services. And the other interesting fact, which I also found while reading the research, was more than visiting a counselor or speaking to a faculty or advisor, they rather felt more supportive while attending the group sessions or the peer support groups that are actually available for sexual violence and sexual assault. So they felt slightly more comfortable going there. So these were the 2 interesting things that I noted in the study. And moving on, this is something I find very interesting because I feel like when we speak to someone who comes from a totally different language and a different cultural background, how even when we communicate with that person, it's so different that actually when you boil it down and try to ask them how they feel, it's really complicated because, again, this is on my experience based at my university. At the university, because when I have a local student who come in the session and I ask them how they're feeling, they say they don't know. So when I dig in further and ask them, are they feeling sad? They express that they're feeling sad. But apart from that, the sadness can be an umbrella term. It can mean so many things for them. Sometimes sad can also mean happy for them. And whereas for someone from a Western culture, I feel what I've noted is they are more particular about the way they feel. Like I feel sad because I'm currently feeling hopeless about the situation. I feel they are more enunciated with their words and they are able to verbalize more. So that is the reason why we recently came up, like some of my ex-students, they came up with this feeling chart. And so what I do, I have a printout of these emotions at my office. So instead of checking in with them and asking what they feel, anger, sadness, irritability, it's a total new concept for them. I ask them to point out at the emotion. So this really helps them to ground their emotion as to what they're feeling. And even empty, if I ask them, are you feeling empty? It would be like a totally Greek language for them because they don't know what emptiness is about. So I always do a check-in with this feeling poster. And also in our language, we don't have any word for love. So in America, you can say I love you, but in Bhutan, we don't have anything for I love you. We only have a sentence for I like you. So I think that's how it can get really complicated as well. Yeah, so this is what I feel is useful, the emotional chart as well. And so the other thing is visibility. And any idea why this picture is so special? This is actually our Prime Minister, our ex-Prime Minister, who was a Prime Minister till this year. He lost the election. But he's also a doctor, so he does go to the hospital for his rounds as well. So people are really connected to this Prime Minister. And also the other reason why I mentioned visibility is that, again, based on the experiences that I've had with American students, is that they come in Googling all their symptoms and they say, I have depression, I have bipolar, I have anxiety, and I'm traumatized. They are more aware of what's happening in their body as compared to local students. So what I try to do is, even though they tell me I feel like loss of energy, I feel I cannot sleep anymore, or I don't feel like doing the things I used to do before. In my head, I already formulate the idea that okay, she or he is eliciting some responses of depression, but I don't use. I try to be more conscious of not using that terminology because it can automatically make them feel that they are sick. We can hesitate treatment for them. So that is why I keep all the diagnosis and what I feel they have in my head, and I work more on the wording that the client gives me. So in case, so let me say an example of, there was my supervisor who I worked with, actually had a person come in for counseling. So he actually, with his wife, works at an apple orchard. And what happened was when they were on this field visit, one of the Asian cub bear, came and scratched off his wife's face. And he was really traumatized. I think he was showing signs of PTSD. And he couldn't sleep for 3 to 4 months. And he didn't feel like eating. He was really afraid of going back to the field to help his wife. And the only reason he came in for counseling is because he was referred via the doctor. So my supervisor, Linda, what she did was, even though she was aware that these symptoms, she's showing signs of having or suffering from PTSD, she made sure to not use that term because for him it would be, what's PTSD? So basically how she tackled around that situation was asking him more through the process of like working through the thought process and asking him, what would make you feel better to go to the field, rather than how would you encounter that traumatic situation? What are the methods that you would use to level down the symptoms of PTSD? What she asked him was, what would you do to go back to the field? Or what would help you? What timings of the day do you feel the bear wouldn't come again, so that it'll lessen your anxiety and slowly you can make more regular trips to the orchard? So, like I said previously, also we work more through a logical perspective, and even the sessions, it's like thought. Asian for us Asians, we are when we go in for counseling, I've noticed that people are mostly focused on working on thoughts, working on problem solving skills. They don't really want someone to sit there in the room and start exploring their feeling and dig it out, as compared to the Western people, that students that came from a Western background. So they work more on the thought processes, on the problem solving skills, something that is more logical and rational. That is what works for our local students. And this is visuals. This is also another important tool. Basically, as Asians, because storytelling is something that has been passed down from our ancestors, we are more of a good storyteller as compared to just abruptly someone asking us, how do you feel, and then just labeling our emotions. So one reason why I put in visuals is during the counseling sessions, it's more easier to talk about the terminology with someone coming from a Western culture, whereas with the local students, what me and my fellow counselor Linda, we used to do is we would have a whiteboard where we would express, where we would draw a diagram and then show it to them like, okay, so you feel this certain way, so what can you do? For example, you didn't get selected for a choir, so your beliefs and your consequences, they are more reciprocal to treatment when it's drawn down to them as compared to when you speak to them. That helps them, the visual and the images helps them to get a better perspective of the treatment process. And I think this is also going back to the time that when a person who was actually suffering from substance use, for example, if the same person was here in the US, I'm sure they would be referred to a rehab center or a NA meeting or an Alcohol Anonymous AA meeting. But what we did, worked with them, because we have shortage again, we have a lot of mental health gap, is we drew out. So basically every evening after he is done with work, he crosses this certain bar at a certain time, which on his way home, which triggers his glands to actually drink alcohol, and he stays there the entire night, and it's been going on for days and weeks and months. So in any other situation, definitely he would be referred to the rehab or some treatment plan. So what we did is we drew a visual representation on the board that how can you just change your route, take a 10-minute extra detour and go home and avoid the store, and will that help you pull down your alcohol withdrawals, or will that help you to not drink alcohol and stay away from alcohol? And I think that worked wonders for him. So sometimes it's just about visual representation for the Asian community as well. And I think one more point I would like to add is in Micronesians and even in my culture and Native Americans, I was discussing it with my supervisor the other day also. In case someone passes away in our family, it's, I wouldn't say common, but it would be a little bit natural for us to have a vision of them in the room or see them when no one else actually has seen them. This is what my Linda also was discussing, which she felt it was really unique. But in an American context, that person would actually be suffering from schizophrenia. So what we actually did in the sessions back in Bhutan was trying to put value in the vision that they see, and what does it hold to them that they actually see somebody when no one else in the room does. And sometimes that is also because of PTSD, they just start to see things, maybe because they didn't get enough closure, or also maybe they just don't have a proper conclusion to the event that they had. So sometimes just playing around these lines and putting on a different cultural lens, it really makes, just the trivial details really make a lot of difference in how you talk to a person that come from a diverse background. And also, while counseling students or people coming from different Asian communities, like Ayesha has already mentioned, there's a lot of cultural and religious factors that come into play. But one thing I think I would like to add on is also especially for the Chinese and the Koreans, the Japanese, the Bhutanese, we believe that whatever has happened to us, the anxiety, the trauma, the depression, is also because of a past life karma. So if somebody comes in and tells me no, it's not because of the past life trauma, it's just because you don't know how to deal with the proper situation, they wouldn't take it well, because what we believe is if anything bad happens to us in this life is maybe we weren't a good person in our past life. Or even in the Chinese culture, for example, I think Confucianism, they believe like in the hierarchy where one of the factors is like selflessness, obeying your parents, obeying the elders, being respectful of your elders. And that sometimes it's a clash between religion and mental health. It's a clash between religion and mental health, because sometimes when during sessions, when you actually check out the DSM-5 criteria of depression, it is also like when you have a loss of freedom of your responsibility and you have a loss of individuality, it can also emit in like feeling hopeless and also feeling like you're worthless or you have loss of personal freedom. It can be a sign of depression, but in the Asian context, actually, the loss of freedom doesn't actually signify a bad thing, because we, as because of the culture and the setting that we are born in, we are very interconnected to our family. That we believe in altruism, and being there for our family and loved ones actually bring in is a support to us and give us more joy. So I think that can also be like a binding factor when it comes like between religion and mental health. It's very contradictory, and and this is another. Am I running out of time?
We're right about out. We're right in time. Yeah.
So maybe I'll just go through this slightly. This is another Clement's health explanatory model, which I like to refer, because most of the questions, I know it's mostly medical questions, but most of the questions have something similar, that is, it checks in a lot with your thinking. How long do you think it'll last? Did they help it? How bad is your sickness? What? It's mostly a logical type of questionnaire, which works really well with our local students. Like I said, they think they are more reciprocative if you check in with their thoughts rather than feeling. And this questionnaire has actually helped me get all the information from my students, which is really helpful in the treatment procedure again. And support and care. How many minutes do I have?
We're out of time.
Out of time?
Yeah.
So, okay,
Yeah.
then
I'm sorry.
No problem. It's okay. And just one last point I would like to add before I close up the presentation is one striking factor which actually stood out while counseling. The feedback that I received from the mentors of the hostel was that why certain Bhutanese students, our Asian students, don't feel comfortable going to an American counselor. One reason is when they feel depressed and sad, that they are not there for their family, because basically their family is even before themselves. And when they go in for a session, what the American counselor, coming from a Western perspective, would tell them is that I think right now you need to think about yourself, because if you aren't happy, how would you be able to provide that happiness to the other person? And I think you need to just prioritize your needs and yourself first, and be more emotionally, mentally, be at a more stable position. And your family, they can take care of themselves because they are adults. And I think that didn't sink really well with few people, because they would be like, what is the disconnect? Why is she not getting it that I am a representation of my family is a representation of myself? So I think this counselor just doesn't get me that my family values everything come before me. So even that was like a striking disconnect, which kind of demotivated them to go back to counseling. So while dealing with people who come from a different cultural context, I think it's very important to be sensitive. And I just wanted to show a video, but I think I don't have time. Do I have like 5 minutes?
Yeah, we've got, some of us have classes we have to
I
head
would
to.
love to stay and listen to you.
Oh yeah, I want to show
Go
a
right
video
ahead.
because I'll just skip through my slides. I don't want to keep any of you all waiting. I'm so sorry, but I'll show you a video. It's just 5 to 6 minutes about one of my cousin sister, who was also a Humphrey scholar before, and she's a very famous journalist, and she's spoken very well on something called as No. And I have noted that most of the mental health issues back home is primarily because they cannot say no. In our culture, it's rude. If someone offers me food, I would rather deny twice, and on the third time, I would take the food because that would mean like I'm being polite, and no is especially considered to be very rude. So without talking much, let me directly jump into the the video.
It's up there.
Chachiton, Mishu. Tosa, Mishu. Chachipenje, Mishula, Amomasase, Nyamabeshna, Tuntun Madu, Las Azitila. Please have a cup of tea. No, thank you. Please have some food then? No, thank you. Oh, I insist you must have some alcohol then. Don't be shy. No, I insist. No, thank you very much. Don't be shy. No, come on, sit down. You haven't said yes to anything. Sit down, sit down. You must have a sip of alcohol. Okay, just a moment. Bhutanese culture does not know the value of no. I'm here today to talk to you about a useless no in a Bhutanese society. We justify the devaluation of a no with a word that exists only in a language. And the word is called nya. Let us leave your dubinya aside. Nya is actually polite refusal when you actually mean yes. Let me illustrate this with an example. So, in most Bhutanese homes, we have annual rituals where we invite monks into our homes and they perform for a period of a day or 3 days, and then at the end of it, we offer them money in envelopes. Now my grandmother is the one who does the offering at home. So she goes with an envelope to the head monk and then offers it to him, and he refuses it immediately. And she's like, no, please accept. And he's like, no, I can't accept it. Goes back and forth, there's a little tussle, and finally, every year without fail, he accepts the envelope. And I'm like, what's that about? What if my grandmother did not understand nya? And she accepted no as being final, and she took the envelope back. I think it would have been a highly undesirable situation for the head monk. Or for any other Bhutanese, actually. You know, Bhutan would be so different if we could value no. Our relationships would be honest for once. We'd be able to disagree with each other on each other's faces instead of each other's backs, which is happening today, even at this very moment that I'm speaking. Some of you may be having conversations at the back. So, you know, there are trivial examples of no, and then there are some slightly serious examples. Quite a few of my friends in Bhutan can't say no, and it applies mostly to their professional lives. So what happens then? They bite off more than they can chew, and then you have sleepless nights, a bit of indigestion, some anxiety, and then sometimes even depression. When did I seriously start thinking about no? Last year, when I submitted Bhutan's first online petition against the non-consensual sharing of sexual material because it was rampant at that point. And when I submitted my petition to the Prime Minister, he asked me the question, how can your no be final? And it got me thinking. I want to talk to you about this traditional courtship custom we have in Bhutan called bomena. I don't see any signs of recognition on our Bhutanese faces because all of you know this as night hunting. And see, there's the reaction. Bomena is not night hunting. Bomena is a respectful traditional courtship custom. What happened over the last few years? Our urban men decided to abuse this courtship custom, and it became what it is unfortunately popularly known as night hunting. You're hunting for your prey, which is a woman in bed at night. Consent in this situation is complicated because you see, in Bhutan, no could mean a yes. It's funny sometimes. Yes, in the trivial situations. But it's not funny when it's sick and sad. And I'm concerned with the sick and the sad, especially when it is indiscriminate sharing of sexual material and you're destroying innocent lives. It's sick and sad when there are women out there who cannot say no. And then they are mothers to what you call bastards. We have hundreds of illegitimate children in Bhutan, even at this moment. They cannot access education or basic social facilities because they have no documentation of a father. This is sick and this is sad. You know, Bhutanese have to stop trying to be experts at sending out mixed signals. You know, a yes should mean a yes, and a no should mean a no. And it's so vital that we need to know this as a woman, as women, as men, as boys, girls, and especially as Bhutanese. Why especially as Bhutanese? It's because Bhutan is a dwarf in a world of giants. And the dwarf survival is reliant heavily on its ability to say yes and no at the right time. We need to value no for that Bhutanese who is traveling outside of Bhutan for the first time on a plane all alone and says no to food because it's impolite to say yes. We need to say no for that Bhutanese who's on a tube or on a bus for the first time and then somebody offers them a free seat. And that Bhutanese turns it down because he or she wants to be polite and stands for the rest of the journey. We need to value no so that a woman, the single mothers in Bhutan, will understand that their no is not useless. We did not endure the suffering. Say yes to no.
Thank you so much for listening to my talk. Yeah, I didn't take much of your time.
Thank you so much to both our presenters and all of the Humphreys Fellows who came today. This was our first time running this program. I think we learned a lot about student mental health, international and multicultural mental health. And I think it gave us some ideas I know I'm going to reflect on the program itself. And when Wendy and I get together at the end of the year, we may see ways to refine or adjust things to have it run a little more smoothly next time. But this was wonderful. Thank you very much to all of the Humphreys Fellows. Please grab a bag on your way out, and for our two presenters as well, a little additional special gift.